Hi, my name is Leticia Vaca Williams, founder and owner of Urban Health Group, Inc. I want to talk to you about healthcare planning and healthcare navigation. These are not two words that we typically use when we think about getting our needs met. We say things like, I'm going to the doctor's, I'm planning for this surgery, mom's in the hospital, I need to figure out if she's going to a nursing home or what's going to happen when she goes home. But I want us to begin to think of and conceptualize the words around those type of issues as healthcare planning and navigation. So with healthcare planning, it involves the steps of creating a healthcare directive, an advanced healthcare directive. It involves identifying a surrogate decision maker or a durable power of attorney, and also having a conversation with your loved ones about your choices for care. Now, these topics tend to come up around a crisis issue, someone emergently needing to go to the hospital, and the doctors need you to let them know what's going on, or end of life. End of life can look like someone who has had a medical condition like diabetes or heart failure, even things like cancer and COPD. These longer term, more difficult type of conditions that have been difficult to manage, end of life looks like with all the treatments, they're just not getting better. Their condition continues to get worse. So, end of life is when folks tend to have these conversations, but we also know these conversations come up on an emergency based type of scenario. I don't know about you, but like myself, I've had a number of loved ones um, need to go to the emergency department for a car accident, an injury they incurred while playing sports, or suddenly I'm just not feeling good, or I'm having a pain that's intolerable. So, healthcare planning is really critical for these types of scenarios. When we talk about a healthcare directive, these are literally instructions that you would provide a healthcare provider about your choices. So, some folks, if there was an emergency case where they're bleeding out, they would not want blood transfusion due to religious reasons. Well, if you're not feeling good and if you go to the hospital by yourself, and there may be scenarios where you can't speak for yourself, how would they know that? So having a durable power of attorney, that's just a person that you say, I want them to make decisions for me if I can't talk or speak, whether it's temporary or you're unconscious or something like that. Having a person to speak on your behalf is really critical. Having the discussion with that person about what you want is really critical. And I know that in a lot of families, we don't tell people our business. But when it comes to needing emergency medical care, or when your condition is getting worse, someone should know so that your wishes are honored. So, healthcare planning are having those three things in place. What we know is true is that a lot of people of color, Black, Latino folks, don't typically have these discussions, and they, in fewer cases compared to our white counterparts, don't have healthcare directives in place. These are life saving measures that research has found to be really helpful with improving quality of life, improving the likelihood that your needs are met, that your wishes are honored. It also is helpful with reducing medical errors. So making sure that you don't get a medication that you might be allergic to in the hospital, making sure that you and your healthcare provider are on the same page about your wishes. Sometimes folks, um, elders, seniors, our grandparents may have decided they don't want chest compressions or CPR if their condition was to change. So having a DNR, do not resuscitate form, is really helpful. Here at Urban Health Group, we help people plan for medical emergencies. We provide healthcare navigation support because not all healthcare systems or insurance types offer the same type of services. So it's really important to know how to get to the type of care, the quality care that you want. So healthcare planning and healthcare navigation are two resources that, again, that can be life-saving and really help reduce the stress on you, the individual who's experiencing it, but also your loved one in the case that they have to speak on your behalf. What we know to be true is that there's a lot of non-traditional family support networks. There's some unmarried folks. There are same-sex couples. There are people who are estranged from their families and they're really close to some dear friends. Well, depending on what state you live in, the next of kin in those cases are the folks that they would reach out to make those decisions. So if you are engaged and you have a longtime partner who you want to be involved in your care or making decisions, you really want to make sure that's a part of your healthcare planning. We have our Plan Well for Care course. We also have master level social workers with healthcare experience that can help you with your one-on-one needs. So we provide individualized care plans so that you have all these things in place. We help with making sure you have the appropriate conversation with the person you want to help you make decisions in the case you can't speak for yourself. And sometimes it's just helpful not to repeat yourself over and over. So having a document that has everything laid out about your choices is really helpful in making sure you connect to the appropriate level of care. Again, this is also an opportunity to help the healthcare providers. When you go to the emergency department, you're a stranger, essentially. They know nothing about you. So getting them really accurate, up-to-date information about your medical history, the people you want in your care, the things that you've tried already, and the things you absolutely do not want as a part of your treatment. And there are sometimes family members or friends that you don't want to know your business. So those things can be listed in your healthcare directives. If you would like support in creating a customized plan, then you can find more information on our website at urbanhealthgroupinc.org, or you can give us a phone call at 510-369-5909. Let us help you plan well to receive the best care.